Assalamualaikum doctors. In this video I am discussing how can we take the HSP, that is Henoch purpora history. So Henoch purpora, that is immunoglobulin A nephritis. Okay, there is features hypertension, high blood pressure we can find. So headache problems, arthralgia, that is difficult to walk. They have purpuric rashes and special distribution of the rashes we know. That is the extensor part, lower extremity, and urine dipstick color. Maybe hematuria is present. So chief complaints come like 12-year-old boy with 1 day history of any hematuria, or can be an 8-year-old boy, 1 week complaints of fever with rash, or limping, the child cannot walk. So how can we take the history? If the chief complaints is fever, so we ask the onset, course and durations. Is there any diurnal variations? What about the measurement method and medications given or not? Then about the associations like with rigor, night sweating or any abnormal movement. Did they all come together, the fever and the rash? If rash presents, then we ask when it started the rash and how long suffering this rash. Describe the rash. Remember in HSP, the rashes is raised on the extensor surfaces of legs, buttock and arms with surrounding erythema. So extensor surface of the legs, buttock and arms. The distribution of the rash, is it elevated or not? Is it itchy? Does it disappear when you press on it? Oozing or not? Punched out lesion and crusting or not? And color of rash. Then other concern like any dysmorphic features, any chronic illness. Musculoskeletal system MSK, we ask the muscle pain, skin lumps, neck swelling. If neck swelling, size, mobile, red, hot or painful. Then any hair or nail, lip swelling, hand swelling, peeling of the skin of the hands or feet. Kawasaki is also a fever with rash present. So peeling of the skin and hands or feet, we need to exclude the DD. Bone pain, joint swelling, redness, number of joints affection, limitation of movements. The general as usual FWASL, that is fever, weight, activity, sleep, these are affected or not. Then CNS, was vision affected? If affected, is it unilateral or bilateral? Redness of eye, hearing, fits. Then bug in brain, decreased consciousness level, increased ICT signs, abnormal movement, weakness, abnormal behavior and hallucination. Then about the chest, any recurrent bug, cough, dyspnea, musical sounds, contact with COVID and smell lost. CVS about the heart racing, blood pressure, exercise intolerance, awareness of heartbeat, pallor, GIT tummy size, pain and its severity, poo, sore throat, lip fissured or peeled, taste lost. Urinary about the pee, change in color, odor, blood burning sensation, frothy pee, pain in the private area if male, that is orchitis. Remember, in Henoch purpora there is private area, orchitis present, and anyone measure the blood pressure. Then hematology, pallor, bleeding and bruising, bug, endocrine, blood sugar measured, past history 5T IOA, that is travel, mosquito bite, malaria, tick bite, Rocky Mountain spotted, and perinatal history as usual, puberty as usual, vaccination history as usual, allergy if atopy, ask in details, allergic march. The nutritional history, development growth charts. Family all, does any family member has current COVID? Ask also about their vaccination status or mouth sores like herpes, eczema, herpeticum. Remember fever with rash, is there any rash around the mouth? We need to ask because of exclusion of eczema, herpeticum. Then social, financial, home, school, last days in the nursery, less than 2 weeks, liaise with them, more than 2 weeks, no need. The psychological or impact, how does this condition affect the family? So any child come with different fever with rash, what are the DD in our comes in your mind? First of all, infectious cause, bacterial cause are like scarlet fever, group A streptococcal infection it is. It can be meningococcemia, it can be group A streptococcal infection, it can be Staphylococcal scalded skin syndrome, impetigo, infected eczema, infected atopic dermatitis, Lyme disease, and cat scratch disease. Viral causes are COVID, parvo, MMR, roseola infantum, that is 6 disease, HHV6, chickenpox, varicella, herpes simplex, and eczema herpeticum, and malaria. Rheumatological causes are SLE, GIA, and rheumatic fever. Vasculitis are HSP, Kawasaki, PIMS, and hematological are ITP. Remember, NAI or abuse. Abuse should be put in consideration in any cases with bruises. So this is how can we take the HSP history. And normally top some DD I am telling HSP, ITP, meningococcemia, any drug reactions, anaphylaxis. These are non-accidental injury. These are we keep. Thank you.